So I don't know if you're aware, but in the past few decades, HIV has really transitioned from a terminal disease to become more of a manageable chronic condition, and that's really largely in thanks to advancements in medication, specifically antiretroviral therapy, so ART. And right now, in all the recent animal models have shown that HIV has some sort of biological basis that's related to hyperalgesia or some kind of heightened expressed pain. So in the animal models, that's been related to GP120, which is glycoprotein 120, and that's actually the little spiky part on HIV that actually attaches itself to the CD4 cells. And in individuals that have HIV that are also pain positive, the glycoprotein 120 has actually been found to be about 10 times more present in that population than pain negative individuals with HIV. So that's really kind of the basis for my poster, kind of the working hypothesis that the more GP120, the more virus, then there's going to be more pain, more expressed pain, more hyperalgesia. So that's really what we tested. We tested that using heat pain. So we looked at that with heat pain threshold, heat pain tolerance, and then temporal summation. So basically with heat pain tolerance and threshold, basically threshold is just when you first feel pain due to the heat, we wanted to know. And tolerance is we asked them to go just as long as possible. And looking at those, and you have the three groups, undetectable viral loads of HIV, detectable viral loads of HIV, and controls, you find that the individuals with detectable viral loads are actually significantly lower on both thresholds and tolerance. So that was significantly different from both controls and the undetectable, which that in of itself is really interesting, that the expression of the viral load, the presence of more virus, is actually being seen in just these like acute clinical pain experiments. But even beyond that, which is interesting, is that the undetectable viral loads, the ones that are, I guess, taking their medication better or for whatever reason, have their virus suppressed more, they look identical to the controls, which is really amazing. So, it looks like if you can suppress the virus or GP120, which is the hypothesis, then their pain state shouldn't be very different compared to controls. And this was also seen in temporal summation. So over a trial, over 5 trials of a heat pain task that actually, so it would ramp up 5 times to a peak temperature, and then we would kind of look at how they rated their pain over the 5 trials, and the difference between the 5th trial and the 1st trial was significantly different and significantly larger than controls and individuals who had a viral load that was undetectable. So it showed that there's some sort of central sensitization or hyperalgesia effect over repeated pain through heat. And what this really shows in my poster and really in our research is that hyperalgesia has really been prevalent in this population, and it is likely due to something related to directly HIV infection specifically, which we hypothesize is the GP120. Thank you so much for having me. This has been a lot of fun.